Thank you very much. I like Stronger Together. It's the claim of my rugby team. And so it's a very given idea. EHDS is not an individual run. It's a team. We need to move because the differences between the EPSOS is that as IHE we manage the projectathon of the European Commission about EPSOS. But the difference that within EPSOS, a very small number of vendors was involved. The vendors of the national contact points. With this new project, every single vendor in Europe could be involved in this project. This is a new approach. So, in which way we can use the word testing? In these 3 days, I heard a lot of time the word testing, and probably everybody has some ideas and different ideas. I want to explain what means for us the word testing with the experience of 20 years in testing, because with the Connectathon, it is 20 years that we improved the system with testing. Because you see here, we need a certified environment. I see a lot of rules and regulation, local regulation. So we need a certified environment. And we focus on the block of interoperability. This is our testing continuum. I believe that we explain a lot of time, but it's better to go in deep of this type of different testing. The first is the plagathon. The second is the Connectathon. Then we have the projectathon. It's very strange that the word projectathon was invented by Charles during the EPSOS project. The first projectathon was the EPSOS projectathon, because it's clear that there is a small group of vendors involved, and this is a small Connectathon. And we see now what is the idea to continue in EHDS. We're talking a lot of time about the vendor journey, because it's important to understand that the vendor are involved in the testing process, but also the users, because the testing phase is the right place to discover if the interoperability could be a good approach in the daily clinician practice. So, plagathons. It's a new word. There are some confusion about the plagathons. Plagathons are testing events, uninformal, because the specs are defined, not well defined, not yet tested. It's a pre-age of the Connectathon, in which the tests are more rigorous. So a mixture of tutorial, education, and testing. Consider one example. We have this, for example, of the last IHE plagathon that we have had in Trieste during the last Connectathon last year. We have, for example, AI radiology. For a week, about 40 different experts from companies and users discuss in the morning about the application of AI in radiology, then go to the floor, to the Connectathon floor, test the ideas, come back the next day, discuss the morning, go to the floor. It's a cycle. At the end of the week, we have a complete deep analysis of the workflow that we want to transform in a profile. Now this year we have some profiles that are developed and tested and rethinking during the plagathon in Trieste. It's a very incredible way to accelerate the testing of the specs and testing some ideas about interoperability in the products. We have, you see that we have an HDS track, very early stage. We discuss about the specs more than the testing, in this case, of the energy. We have also the energy that is an industry outside of care that looking to us to use the same approach that we have for interoperability, because it's clear that interoperability maturity is higher in healthcare than in other domains. This is, for example, the plagathon tracks. A plagathon is an event. The track are the different topics that are discussing during this week. This is the plagathon that will be next week in Toronto. It's a North American plagathon. You see that, for example, you continue discussing about AI. We continue discussing about the usage of IPS, because we are moving, now we are able to share IPS, but what can we do? What is the use case in using IPS? So we move to the next step of the game. And then we have, you see also some local specs, Canadian interoperability in this case. It could be a good idea when you have localization of global specs, that in our EHDS will be the local specs that each country will add, of course. Yeah, then we're moving to the Connectathon. What is a Connectathon? Connectathon is a well-defined process. To give you an idea, is a big room with a lot of engineers that test each part of the interoperability framework in their home product. Now you see all the laptops, but I remember at the beginning, you see the piece of the CT scan unit on the floor, because it's a completely different approach. Now a laptop is sufficient. Oh, consider now you see a physical floor, but in reality, all the infrastructure is a virtual floor. So we have developed the concept of virtual floor, and you can perform physically the testing or remotely. It's clear that the physical presence, the face-to-face, is more productive if you want to speed up some processes. Then you will continue at home. So we introduced also the concept of continuing testing. This is the numbers. Consider that in 20 years, there are more than 800 companies that has attending in Europe, North America, and Japan Connectathon. And they have tested a lot of profiles, much more than we can imagine. So what will happen in June in Vienna? We will have the Connectathon Week. Connectathon Week is an interoperability event in which there are different events, small events. For example, there is the Connectathon, there is the Plagathon, there is also a Projectathon, the Austrian ELGA Projectathon, and also the particular and dedicated seminars, like, for example, the Experience Day, today to share the experience from different users from different parts of the world. The Connectathon pre-registration is open, and so everybody could pre-register his system. It's not a commitment. You can pre-register your system, but for your reason, don't complete the full registration. So you have not to pay anything. But it's very useful, the pre-registration, because you have a discount, first of all. The 25% of the fees are discounted if you pre-register your system. And of course, give us the possibility to organize in a better way the floor for your testing expectation. Because it's important, this point. It's not an individual game. It's a community game. I give you an example that is very inspiring for us, because are coming from the North American market. You know that North American market seems to be a big market, but in reality, there are 3 companies that cover the 90% of the market. And so for me, it's a small market, not a big market. It's a big market as a value, but as diversity, info diversities of the company is a very small market. So the big player, Epic, Cerner, for example, registered to the North American Connector and discovered that it's not possible to test anything because we have no small companies. And so they're starting to discover that they need all the companies, all the small companies in the market, because when you test, when you have a test scenario, you need more companies that you can for complete the test scenario. This is very important to understand that participating in the Connectathon is not only an individual goal, it is to support the community. because if you can use the Connectathon for testing and for the conformance of the vendor's project, will reduce the cost, will reduce the time, because the challenge is time. Yeah, we have 12 months, 1 year, to reach the goal of EHDS. We have to move from paper to products. It's easy. No other possibility. We need to continue and develop more implementation guidelines, more position paper that are important for the direction that we need. But in reality, in parallel, we need also to start our product life cycle. So you can register yourself pre-register yourself if you are interested in the Connectathon in Vienna. For the Plagathon, we are defining the program of the Plagathon, and probably in March will be the complete list of the tracks of the Plagathon in Vienna. But for sure, there will be two tracks. All these 2 tracks are about EHDS. One is patient application oriented, and the other one is healthcare providers oriented. In order to split these 2 tracks, to have a focus, you know that there are some European projects about these 2 approach. My health in my hands, for example. We have the yellow button in other projects. And with I2X, we have another project that use the goal of healthcare provider application. So we split this track. What will be during the week in Vienna? We have the opportunity to spend, I believe that 3 days is the right length of a Plagathon, but we will see if we need 4 days or 3 days, in which there are some tutorials. So companies that are not yet completely ready in their products could attend. Of course, the focus is the technical guys that they are in charge to develop the interfaces in the products. And so it's a dedicated session tutorial, discussion about the open points, and of course also the capability to test against simulators, validators, and so on. I only want to check one point when you're talking about testing. Everybody believes that we have the peer-to-peer testing, vendor A with vendor B, connect the 2 systems, and we see if there is change in the right format of the data. This is we call peer-to-peer test. But in reality, there is also no peer test. I test my system against a simulator. This is very useful for the concept of self-certification that we have seen in 5 minutes ago. But we have another important part, that is the simulators. Each vendor needs simulators to have a good quality in the development of their own interface, because with simulators, the vendor can have the complete scenario on which the products is inserted. So simulators are very important, like simulators. Experience Day, we will talking about, of course, about EHDS. You see that the second day is quite completely dedicated to EHDS. And then, what is our proposal? Because only having one event is not sufficient, because we want to insert the testing strategy in the life cycle of the products. And so give the opportunity to have 1 year time in which all the vendors have the support of the testing community. And so we're starting with the Plagathon in Vienna in June. Then we plan to have a Connectathon in 26, probably in March, and probably, but is not sure in which venue, but there is a good opportunity to have a central venue like Brussels. At the end of this time, all the vendor community has the capability to develop their own interface in their own products, and ended with the Connectathon testing in March. Then what happens after. We have finished everything? No. In reality, we are starting, because then we add in new feature, we clarify some use cases, and we find this loop of testing specs, in order to refine the specs and the products. And probably, as the European Commission has said a lot of times, there will be a conformance program for the EHDS. This is very important because it's the closing the loop. In our experience, we have a lot of, not a lot, of projects that closing with the conformance part. An example is the Swiss project, in which there is a projectathon approach and then a conformity program approach. Probably we will see the same in Canada next year. They have made the phase of the projectathons and now are moving to the conformance. A similar program of conformance is for Italian project called about telemedicine. I believe that all the same with INS, I believe the same, and so on. So this is important. We're closing the loop in this way. And we see to the community of the vendor, this is our proposal to speed up the adoption of EHDS. So this is a very nice slide of Alexander, of course, because it's clear we're talking about bits and bytes, cable and computers, but at the end, the added value, and we have discovered during the COVID era age in which we have completely remotely Connectathon, the added value of the Connectathon is to create a real community of developers that are spread in different vendors across the world. Thank you.